Okay. Welcome to our school's town hall. Thank you all for being here and joining us today. So I'm Katie Dashiell. I'm a talent engagement manager at Supplemental Healthcare. I've been at SHC for about 4.5 years now. My role focuses on our social media presence, content, webinars like this, and I just love being able to share stories about our talented healthcare and school professionals. So I'm also joined today by members of our school's Center of Excellence team. So we have Andrea and Alex. I'll let them introduce themselves as well. So Andrea, you're up.
All right. Well, thank you, Katie, and thank you all for joining. I'm the National Senior Director of Schools and began with SHC 13 years ago as an allied recruiter. And currently, I actually partner with our 3 school centers of excellence and then all of our local teams to help and support and enhance our educational programs from coast to coast. So I look forward to our information sharing and questions ahead today. I also work closely with Alex, who's our amazing strategic account manager who's on our call. So I'll pass it to Alex.
Thank you, Andrea. My name is Alex Hanslick. I'm a senior strategic account manager here at Supplemental Healthcare. I've been with the company for about 2 years, and in my role, I work with both our MSP and school centers of excellence. I oversee a few of our MSP accounts and specialize in school healthcare staffing. Just like Andrea said, I'm really excited to share some great insights and information with a few of our panelists today on the call. So thank you, Andrea.
Great. So just to kind of go over what we're going to be talking about today, on today's call, we're also joined by some of our school leaders that are sharing their unique perspectives and plans for the upcoming school year in their districts. We realize that the challenges around COVID-19 will continue and that changes will be made. But in the meantime, we wanted to talk about what some of our schools are doing and have them share their experiences around hybrid solutions, enhanced technology, role changes, and innovative resources as we look to the 2021 school year. And then we'll also wrap up with some resources that we've compiled and just remind everyone of the support we offer with our School Center of Excellence team. So with that, I'll pass it back over to Andrea to introduce our panelists.
All right. Yeah, thank you, Katie. And I have the great pleasure of introducing the 3 panelists we have on the call today. So please join me in welcoming Dr. Michelle Thomason, the Director of Special Programs at St. Joseph School District in St. Joseph, Missouri. Dr. Tanja Williams, the Associate Superintendent of Student Support Services at Buffalo Public Schools in Buffalo, New York. And on behalf of Erica Richley-Duda, who is the Executive Director of Special Education at Summit Academy Management in Ohio, I'll be speaking on her behalf while she's actually enjoying some vacation time. But with these ladies combined, we have over 74 years of educational services experience and background on our panel today. And I know I am just really looking forward to the wealth of knowledge and then the insights they each can share. So with that, I'll turn it to Alex to get us started.
Thank you. And our first panelist is Dr. Michelle Thomason from St. Joseph School District, who I've been able to work with over the last year. And she's going to go over some challenges and solutions that they've had there at St. Joseph School District. So thank you for joining us today, Michelle. All right. And our first question that we have is, what challenges did you discover with the transition into innovative learning?
Well, we discovered a lot of challenges, just like everyone else did in the education world. When schools were closed, we hadn't trained our staff, a lot of them, in remote learning and in best practices. And our school announcement that it was canceled happened over spring break. So there really wasn't much notice. Everybody had gone home for break. And while we were on break, we found out that we wouldn't be returning, and the students realized they weren't returning as well. And so the teachers and the principals and the special education staff really had to come together rather quickly and come up with a framework that could be deployed. St. Joseph, Missouri is an urban demographic. We're about an hour north of Kansas City. It's a very blue collar community. And we anticipated that we were going to have students and families that did not have internet access at home. And we were working through a plan to support those families. One of the things that we did not anticipate, however, was the number of staff members that we had that did not have reliable internet access. And so that posed a real problem for us. And we had been so focused on the students and how were we going to educate our children and our students that it was kind of one of those aha moments that made you pause, and we realized, oh, hey, we really need to shift to the adults as well. And so we did. And to further compound that Wi-Fi and internet access problem was there weren't any hotspots available anywhere. There were none in St. Joseph. That we called every cell phone provider, we called every technology store, anybody we could think of, and they just weren't available. And so we had a lot of staff that were driving in and sitting in their school parking lots because our buildings were locked up. They weren't allowed in, but the Wi-Fi access would reach them in their cars. And so they would sit in their cars and email and do virtual lessons and set up Google Classrooms. And everybody really had to come together, but it was a really challenging situation. And some of those challenges were things we just did not anticipate.
Thanks. Yeah, that's definitely, we're really just thrown right into it. So thank you for sharing that information with us. Our next question is, what are your plans for the 2021 school year to meet all your students' needs?
We released our plan on Monday, and we have about 11,000 students in over 20 buildings. And so what we really wanted to do is look at what was going to work for our families, what was going to work for our staff. And one of the things that we realized when we transitioned to virtual learning was our schools had different people had different capacities. They had different experiences, and their comfort level and competence level in deploying virtual instruction varied greatly. So when we deployed this plan, we kind of took all of that information and other information and what we decided as a school district was our community and our staff really needed to not go with necessarily a hybrid solution. So we're not doing 2 days at school and 2 days at home. Our families have the opportunity to choose. And so the information went out Monday, and we have families right now choosing whether they want to send their child to school virtually or whether they want to send their child to school in person. And to make that work for students with IEPs and disabilities, our special education staff started on Monday making personal phone calls to every single one of our families of students that have an IEP, which is about 1,600. And so what they're doing is they're going through the CDC guidelines for students who are going to be at the highest risk for developing severe COVID-19 illness if they were to contract it. And having those conversations and really building awareness for families, and then talking them through what could virtual instruction look like in the fall, because it will not look the same as it did in the spring. In the spring, we were all just thrown into this chaos and nobody really knew what they were doing. We've had time to work all summer and have had teams working all summer long to develop what we would consider best practices based on research and based on what we have available. And so our plan really is to deliver best practices to students educationally, and whether that be virtually or whether that be in person, and let the families decide what works best for them so that they can work. If they need to work, their children can come to school in person if that's something that will work for them. Or if they have somebody at home and their child needs to stay home, or they feel that would be the safest and best option, that we would be able to provide those best practices and fulfill their IEPs in a virtual setting.
Thanks. Yeah, that really, it just shows providing some flexibility for the families in these uncertain times. So it's great. Thank you. And our next question is, what partnerships and resources have you found valuable during this time?
Well, partnerships right now, I mean, partnerships are always important, but I think they are especially important right now because we're all in this together. Everyone's in this together. Everyone's trying to figure out the best path forward. And one of the most important partnerships that we have is with supplemental healthcare. And our experience in the spring really brought to light that the different experiences of our staff, and staff who were very tech savvy and were very confident and felt good about experimenting with technology and instruction, provided a really good virtual instruction for students. And then we had people that were almost paralyzed by the thought of doing that. We had staff members that really weren't comfortable with it. And so what we are doing with supplemental healthcare, I reached out very early to you, Alex, and asked, is there some sort of teletherapy, teletraining that we could provide to every single one of our therapists and possibly to our teachers that would give us a more consistent practice, a more consistent model that we can put out. So regardless of what school you attend and what part of town, that you are getting a consistent high quality education if you're virtual. And so you guys got on that really fast, and we're working with .com teletherapies, and they're developing a professional development model that will be virtually deployed to our staffs. And they will be able to then, we're going to be able to set best practices. And this is how you provide high quality instruction through a virtual environment. So I'm super, super excited about that. Locally, one of the biggest partnerships we have and a way that we're collaborating is our county received CARES Act funding, and they really support our school district and they support education. And so they made it a huge priority for the school district to be able to access some of those funds, because some of the things we have to think about are if a student is going to go virtual and they have physical therapy or occupational therapy, not only what does teletherapy look like through technology, but what supplies and resources are they going to need? So we really had to look at what extra expenses will we have? Do we need to purchase therapy? Do we need to purchase supplies that we can send home with students with job boxes? Another thing that funding, that County CARES Act funding that we're able to do is that's one of the ways we are able to make those phone calls to every single family is we selected and asked for volunteers of a high quality special education team to look through every single IEP, make contact with every single family and talk through what virtual instruction would look like. And we're able to pay those employees by using that County CARES Act funding. And so really it's been on the business side and collaborating with supplemental, but also those local agencies that we have around that we have found really beneficial to collaborate with.
Thank you. And we definitely enjoy collaborating with your district as well. And it definitely, your response just painted us a better picture of everything that's going on. It's definitely a busy summer, you could say.
Right.
All right. And then our last question is, what positive outcomes have you seen in these challenging times?
I think probably the greatest for our school district and for our staff is that COVID-19 has really pushed us to be innovative. It's not okay and it's not going to be acceptable to do what you've always done because it's not going to work. We're having to social distance when we're in person. Students or the classrooms are going to look completely different. While we're working on teletherapy and teaching class virtually, that's going to look completely different. And so we're really pushing the envelope in innovation and having to get creative and really find out what do students today need to be able to learn. It's not going to be acceptable anymore to look in a classroom and see what the same type of instruction that would have been occurring back when I was in high school in the 80s. The students today are different. They're not the same. And so they don't need the same type of education that we received. And I think that's probably the most exciting silver lining that I've seen is talking to the teachers and listening to the teachers talk about the things that they want to try or the things they tried during summer school or in the spring that were super effective. Things that I never really considered or thought was impossible. And when everybody works together and really pushes the envelope and then shares those ideas, there really is no ceiling as to what we're capable of.
Exactly. And it just goes to show you there is some positives that came out of this. And, you know, we just wanted to share those. So thank you for sharing those kind of silver linings, just as you said. And that is all the questions we had for Michelle. So thank you very much, Michelle.
Thank you.
All right. And our next panelist is also somebody that I work with closely and on a daily basis, Dr. Tanja Williams from Buffalo Public Schools. Welcome, Tanja. All right, our first question is, what challenges did you and your team experience upon school closures at BPS due to COVID-19?
Well, it was like a whirlwind. I remember the day. It was March 17th because it was St. Patrick's Day. And we had gotten the word that schools would be closing. And we all thought maybe a week, maybe 2 weeks. But even with that, there was a lot that we had to pull together. So, for example, creating and copying thousands and thousands of instructional packets for children and making sure that those were disseminated, creating systems to ensure that children had laptops and iPads, and that, you know, we had a system to make sure that we knew who had them, and even chargers, you know, were all of the chargers working properly. We had to work with our families to try to help them with identifying hotspots. We were right in the midst of assigning students for the 2020-2021 school year. So registering students, we had gotten in registration packets and we were in the process of getting them registered. We had to create a whole new system for how that had to happen. We had to look at creating a new grading system because when this hit, it was right in the middle of a semester. So we had to look at how would we create a new system that would not penalize students, but certainly would hold students accountable for the work that needed to be completed. We looked at all of our schools, each one of our schools, and we have 60 schools and about 32,000 students. More than 50 languages are spoken in the Buffalo Public Schools, but we have a mental health clinic in every single one of our schools. And so we had to make sure that all of the students who were connected with those clinics and schools had a continuity of services. So we had to create systems to make sure that we were measuring and monitoring that piece. We had to create a tracking tool for those students that had not logged on to make sure that someone was looking for those students to make sure that they were safe and well and everything was okay. Attendance became quite an issue for us, and how we would take attendance for students. Would we look at simply a student logging on to one of our instructional platforms, or was it the work, the meaningful engagement that we would be taking attendance for? What if a student, because it's remote, decided to log on at 6 o'clock in the evening as opposed to, 9 o'clock in the morning when the class started? Would that still count? So we had lots of discussion around that. Ensuring that because we live in a city that is the third poorest city in the United States, we had to make sure that, we had food for our children and for our families. And so for all of our children and families, we offered the service of 2 meals per day. So we had to get that all organized. There was a lot of work that went into that. We set up a hotline so that parents could call and identify if they, were having issues with connectivity, or if they had questions about meal service and where that might be offered. We got a range of questions. So we had to set that up. We planned remote graduations. That was quite something. We wanted to honor our seniors in a way, that's a milestone year. It's a milestone event, and we wanted to give credence to that. So that took quite a bit of maneuvering when you have 16 principals with 16 mindsets on how they wanted it to happen. But we are very proud of, the way that everything turned out. A lot of our students experienced grief and loss, during this time. Unfortunately, we've lost some staff during this time. And so we've had to figure out a way to provide support to the children and to the parents when students log on and their teacher is not there. So we've been, we've kind of turned things upside down, inside out. And we had to do it very quickly, but we all pulled together. And if there's one thing I'm proud of, it's that we all pulled together and we all made it happen. And supplemental was a huge part of that happening.
Thank you. Yeah, it definitely seems like it was all hands on deck, and especially with everything we collaborated with, I can definitely see it was. So Thank you for that answer. And our next question is, what safety measures and protocols are being considered for your district, for Buffalo?
So I'll share with you that our superintendent, Dr. Kreiner Cash, has a very high standard for safety and welfare, not only for our children and families, but for his staff also. And so we are currently really evaluating carefully 3 different models. And the first would be a 100% return to school brick and mortar. The second would be a 100% we stay remote. And the third is kind of a blended option between the two. The district is planning to release our plan on July 31st. We've put together multiple think tanks. Supplemental has been a part of, me bouncing ideas off and getting support for, some of the health and wellness pieces that have to happen when we return. We want to make sure that we're adhering to CDC guidelines, to the New York State Education Department, to our local counties' Department of Health, and all of those things as we create new policies and moving forward. We're looking at instructional practices. We have a very active union. We have several unions that are affiliated with the school district. And so we've involved them in what reopening will look like. Safe and healthy, safety and health are 2 of the most important pieces of this plan. And so there's a lot of work that's surrounding that area. Everything from the logistic piece, most of our students are bused. What will busing look like for the children? If they want to go to the water fountain even, we're considering every single small thing that we can think of to make this as comfortable and as safe a return as we can. The social emotional wellness is another huge component. So we know that when our children return to school, they've experienced so much. And so when they return for the first couple of weeks, it will not be business as usual. We just jump right into instructional practices. We're going to spend some time making sure that schools are healing circles or healing environments. We're doing restorative circles. Children will be welcomed back. And for our staff, we also want to give them some safe places to discuss some of the things that they've experienced, some of the loss that they may have had, because we know that whatever plan we put together will only be as good as the adults are healthy and able to implement it. So we want to make sure that everyone holistically is included in that plan. So that's why we've had so many stakeholders at the table, because we want the voice, we want to lift the voice of, parents and what are their concerns and what's important for them, and, teachers, what's important for them. We have some of our staff members that are, they have underlying health conditions, and we want to be able to, respect that and understand that. And as we're scheduling, try to do things that will minimize maybe their contact. So this is a huge lift, but
Yeah.
we're right in the midst of it, as you know, because, Supplemental is also supporting us with creating this plan.
Thank you. Yeah, it's a lot to think about, and thank you for that answer. We'll jump right to the next question, which is, how have the roles of the health clinic nurses adapted through this time?
So I will start by saying that, and I love this picture that you have up on the slide, the nurses from Supplemental, and I've shared this with you, so it's really not something that I'm just saying off the cuff, have exceeded every expectation that we have had. As the needs of our district evolve, this is a constantly moving target. It's constantly moving what we need, what the families need. And as needs evolve, and I call and I ask, can we do this? It is always, let's see how we can get it done. It's never, a no. We're really appreciative of the work of the nurses. They have put their lives, at risk. They all have families to be on the front lines for the greater good of our district. And we appreciate it. Many of our nurses became, in schools, it becomes almost like a work family. And so when this happened, in addition to teachers not getting to say goodbye to their students, nurses didn't either. They didn't get to say, goodbye or to close out. And so, for them to maintain the professionalism that they have is just great to see. In fact, so much so that our superintendent, because we are part of the Big Five for New York State, has to submit a report weekly to Governor Cuomo. And in one of his reports, he lifted the nurses from supplemental. He put some pictures in, and it's not easy to make that bulletin, but he did, because he is that appreciative of the work that they're doing. But some of the things that I know that they probably were confronted with was needing to shift really quickly and to begin working in buildings that they had not normally been assigned to, which meant small things, but things all the same. Needing to understand, where do I even enter the building? Where do I enter the building at this school? Where are the thermometers housed? Who is the principal? And what are his or her expectations for how things happen? Where will temperature readings take place in a building? And so, we know that every time we called supplemental for a shift, all of those things probably played a part in making sure that things were organized and ran well, and they did. They became really the first line of education for many of our staff on what is COVID and how do you stay safe, and so, that was important. The nurse supervisors, oh my goodness, what a powerhouse little group of women. It's 3 ladies for a district with 32,000 students plus. And they came one day and just unpacked masks, rolled their sleeves up, went into the boxes and divvied them up and put them in their cars and went and delivered them to the schools. So, things like that are just, it's just heartfelt to see. So those are some of the things.
Yeah, and we're very appreciative of our nurses as well. And thank you for those kind words to the nurses. We love them. And then our last question, Tanja, is what positive outcomes have you seen in these challenging times?
So yes, these have been challenging times, and I liken it to a phoenix. And the phoenix is a bird that rose from the ashes. And so sometimes, I think during the most challenging times, it forces you to bring out a sense of resiliency. And I think that is exactly what has happened. The community has banded together like I have never seen. And I am a native Buffalonian. I've lived other places, but I'm a native Buffalonian. And the way that I have seen, from grassroots organizations to banks that offer meals to, some of our essential workers, to NFL players, donating books and toys so that, it's kind of an escape for the children, has just been remarkable. Just people who wanted to do something, offered to deliver meals to some of our children living in homeless shelters so that they would not have to try to find public transportation to come to a site to secure a meal. So it, for me, has reinforced the best in people and the way that people have just surrounded, just insulated our school and school district. I think for the staff, what I've seen is that we've identified innovative ways of doing things that have turned out to be efficient, still providing access, opportunity, and quality. But had this not happened, I know for sure my technology skills would not be what they are today.
Yes.
We were stuck in this archaic way of thinking that for every single meeting, it required us to travel and go someplace to sit and physically be a part of that meeting. And I think with, what has happened, we realize that, there are other efficient ways that we can get things done. We have engaged our parents on an entirely different level. They are partners. They are partners in this work. We have their most treasured gems, and we appreciate that. And we listen, and we've amplified the voice of parents due to what has happened now. So I think our partnership with Supplemental has just really been solidified through this process, because I think principals, I've been a principal, I was a principal for several years, and I think as a principal, that the work of a nurse is important, that. But I think it has gone to an entirely different level now, because the nurses are working on the front lines. They're not in their clinics. They're right on the front lines working side by side with principals, cafeteria workers, custodians, volunteers. And I think that there's a different level of appreciation and understanding for the work that they do.
Yes. Thank you so much for those kind words again. And I think that once again, it just shows that there are silver linings within these times. So thank you very much, Tanja.
My pleasure.
All right. And our final panelist is, on behalf of Erica Richley Duda, is Executive Director of who is the Executive Director of Special Education at Summit Academy. Is Andrea will be speaking on her behalf today. So welcome back, Andrea.
All right, thanks.
All right, first question. What challenges did Erica say she discovered with the transition into innovative learning?
Yeah, well, thank you, Alex. And Erica shared 3 primary challenges: technology, training, and finally completion of work. So technology, like both Michelle and Tanja have already shared, was not available to all students. Some students had access to computers, some didn't. And even then, those with access weren't even clear as to where to access their schoolwork. So I think going forward, this is why Summit will be one-on-one with students on that technology piece, and have been evaluating how to address the lack of internet access for some students as well. Training, we've heard about that already too, is a real challenge. While teachers and some therapists were fluent with the use of that technology, like for lessons, creating videos or hosting online sessions and creating assignments, some definitely were not. So the Summit team has incorporated more of that actually into their professional development in the upcoming weeks. And then finally, that completion of work was that third area. Many had challenges just determining the amount of workload issue. Sometimes the amounts weren't that consistent across the board. So I think going forward, the #1 priority is the collaboration amongst the staff. We've heard that similarly through the conversations today. The staff's going to set up some common due dates for work completion and being specified in the Summit's reopening plans.
Thank you.
Mm-hmm.
And our next question is, what has Erica learned from the task force about reopening plans for Summit Academy?
Yeah, great question, Alex. Thanks. Erica actually was on the reopening task force since its inception in late May. And so the intent was to support the following: align Summit Academy reopening efforts with the Ohio Department of Education's Reset and Restart Education Planning Guidelines. So Erica shared 6 key objectives that the task force has proposed for those reopening plans. The first one is to ensure that consistent guidelines are implemented across all of that Summit Academy school with consideration to the specific building needs. Again, protecting the health and safety of all by supporting the state and local efforts to control the spread of COVID-19. Providing guidance for assessing and protecting the needs of the most vulnerable students. Instructing the students to determine present levels of academic, social, and emotional functioning to determine those next steps for each student. And really just addressing that social, emotional, and physical health of all the students and the staff. Next up was developing a system for really that 2-way communication. So with families, teachers, the staff, all being focused on those expectations and needs that are being met, and of course to support the families and their students. And then finally, providing that guidance and then identifying training that's necessary to really best support all.
Great, and definitely all-encompassing plans. Thank you for sharing that with us.
Yes.
All right, and our next question is, what is the plan around educational configuration and technology in the reopening solutions?
Yeah, and so Erica elaborated a little more of the hybrid model, and that was developed and suggested and accepted actually for the start of this school year, 2021. And so the reopening plan describes many specifics on just cleaning and sanitizing schedules, the modifications to communal areas, of course, details on all the daily health assessments of students and staff. But specifically, the schools have been asked to identify a hybrid model, either a 2-day or a 4-day-a-week attendance. And still, students are going to use that common platform of Google Classroom, and they're going to use that even when they're in the brick and mortar or if they're actually working virtually. And so all schools will use this as a unified technological platform, and then also have identified some due dates for work to be completed, like homework on Mondays. But a key thing is that the related service professionals are expected to collaborate with principals, as they usually have, but really create that service delivery plan that's still largely focused on providing services as if the students were in the building. And exciting is that on the technology piece, all the students are actually going to be assigned a Chromebook to use both inside and then outside of school. So weekly check-ins are definitely a minimum when students are working virtually. And then parents, students, the teachers, and the related service professionals are all going to be attending and required to participate in some training for the use of these Chromebooks. And then, of course, the virtual platforms, so like the Zoom, Google Classroom, et cetera. Again, the word of collaboration comes into play. So this is a unified and collaborative training that will really ideally promote clarity, hopefully efficiency, and ultimately overall positive student outcomes.
Yeah, it definitely shows that technology is more important than ever. So, And finally, what positive outcomes did Erica mention from these challenging times?
Erica said great things about how many of the teams have seen such a number of relationships just really grow through this process. Parents who weren't as involved previously were able to make connections with staff and really see all that the team is doing and has been doing to help to support just the overall growth of their child or children. And even students felt even more supported as well. The one thing she definitely shared was that the creativity just blossomed. I've heard that as well on the call today. Graduating students move forward despite the final quarter being very unexpected. The schools shared photographs and videos of graduation ceremonies and those promotion ceremonies, so for any students from middle school to secondary, and they've all been done in a unique way. One school had each graduating student write a graduation speech, which it all was then compiled into a master speech that was given at each individual ceremony for the school. So it was just a really great way to celebrate their individual successes, but also really just give a nod to the class as a whole. And so it was really exciting to see some of that feedback.
Yeah, I mean, that's awesome. That's the first I've heard of anything like that, and that's just really, really cool to hear. Thank you, Andre, for sharing that information on Erica's behalf. All right, next, I know that we've had some questions rolling through and some are being answered. Katie, were there any questions that you wanted to answer at this time that might have come through?
Yeah, I think we just had one for Andrea. Andrea, will therapists be able to meet with my students face-to-face on the days they are not in the building? I don't know if you know the answer to that one.
I'm not sure, but I have to ask if I'm wondering if that's one of our Summit clinicians who might be asking. So I could probably take that offline with them.
Sounds good. And then I think we had one earlier from Michelle, or for Michelle, which she already kind of answered, but just to reiterate that one. How are you planning to address the assessment piece for the 2021 school year, whether it be eligibility or for 3-year evaluation? So Michelle, I don't know if you want to just share really quickly what you had typed into her.
Sure. One of the things that we're doing, and is we're going to purchase some electronic assessment protocols. And basically the way it works, and I haven't necessarily seen it in action yet because this will be all new, is that there will be two Bluetooths that will be connected, or two iPads that will be connected through Bluetooth. And so the evaluator will have one and the student will have the other. And where it's appropriate, then the evaluator and the student will be able to remain 6 feet apart or socially distanced. They'll be in the same room, but we'll be able to give them enough space in order to make everyone feel like they're being safer. And so we'll be delivering some protocols that way. And another thing that we are doing is we're looking at a remote location that would be a district building or a district room that families, maybe they have a child that's medically fragile and they're okay with bringing them in for an evaluation or an assessment, but they don't need to be around other students. And so we would have a room with a different exit and entrance that they would be able to enter so we can get that evaluation completed. And then send them on their way without coming into contact with anyone else.
Great. And then I think we had one more question for you, Michelle. Will St. Louis psych examiners test at their assigned school sites or other locations?
We will go wherever we need to go, basically.
Sounds good. And then I think those are the only questions that are kind of more general. I think we have another one for Erica, but might be better to kind of answer as follow-up since she wasn't able to join the call today. But if there aren't any other questions, we'll move on to the next slide. And back to you, Alex.
Sure, thank you. And we just wanted to share some resources out there that can help your districts navigate through this time. And we'll provide this slide to everybody as well after the call, but it's just access to links for all the resources we discussed today. And this is a list for the CDC, therapy boards, National Association of School Nurses, CASE, State Education, and our partner.com, which Andrea will actually go into more detail about right now.
Yeah, great. Yeah, thanks, Alex. So this is just a closer snapshot of that Better Together portal via the .com website. And so this link offers really specific resources for families, the therapists, or even for our school administrators. And so from here, you can click on that portal that's just most relevant for you and can register for some coffee chats as provided by the .com team. And then also browse that complete resource library, which we'll share on the next slide real quickly. And so this, again, is just another closer view of how those layers of support are available, whether it's, again, like the coffee chat to actual virtual therapy exercises, to then just some ideas on the school contingency plans that are available. And so with that, I'll pass it back to you, Katie, for just a final wrap up and then just additional resources and support.
Great, thanks, Andrea. So we do have some great internal resources as well. We've had some blog posts recently around just the changes that have been going on with schools. We also had a sit-down conversation roundtable with some of our school professionals, just discussing everything that's been going on from their perspectives. So we'll send those links out as well afterwards. We also are excited about our back to school campaign that's going on, where we're sending our school professionals back to school shirts. So they'll have received an email about that as well. So those are just some additional resources that we have internally. And then just to talk about SHC support system that you have across the country. If you do have any additional questions, we'll share this deck so you have all their contact information as well. So thanks again, everyone, for joining. If there's any additional questions, feel free to reach out to SchoolSolutions@shccares.com or any one of us from the follow-up email. We'll be sure to send everything afterwards. There will be a form to provide feedback if you do have any on this webinar today and for future ones as well. Just help us the next time. And so the recording, as well as the deck and resources, will be available in the follow-up email. And just look out for future calls like this and other ways to engage with us. So with that, thank you so much to our panelists and everyone that joined us, and everyone have a great evening.
Yeah, thank you all.
Thanks, guys.
Bye.